Okay, I think we have some critical mass here that we can begin. I doubt that we're going to use the full hour today, but I want to thank you all as always for making time for us to have this conversation. We are in our 19th week running this weekly meetings. We know that this the APA program of the Afghan Paralegal program is winding down. We know that the program is going to come to an end at February 15th, and this condensed arrival that we've been having since September is probably going to slow down, but it doesn't mean that the resettlement effort is going to end, because I didn't look at the numbers today, but so last week we still had about 169 people in hotels. That number continues to change with the direction of the wind. This week we had projections, and of course that has changed with the weather. So it's hard to keep track, but we still have a long runway ahead of us in terms of completing this program, and we would like to keep these weekly meetings going on till at least the end of February, and then as we look forward into March, depending on volume, because we're still going to have Afghan arrivals. Added to that would be refugees from other parts of the world. So there's still going to be the work that needs to be done. And because we're on the front end, we're taking every available stock of housing that's out there for those people who are here already. It definitely means that those people who start coming after this program has ended will be confronted with similar challenges, right? Because we will still be scouting for houses, probably for the next 6 weeks after the program, to get everybody drawn down from hotels into housing. So this resettlement effort is probably going to continue. And it may be important for us as a group to see this as an opportunity that doesn't end with the Afghan arrivals, but to keep this conversation about this community and how we collaborate to make it welcoming. I know many organizations here are working towards that end in mind. And has this given us an opportunity as a community to continue this collaboration beyond the Afghan arrivals, and what that will look like and what that will mean for the St. Louis community is the opportunity. But in the short term, we're going to keep going with the weekly meetings till the end of February. And then at that point, we'll make a decision whether to go every 2 weeks, or we will, we'll put it out there to you all to share your thoughts on what you think. But we have seen tremendous value from a community standpoint, resource standpoint, capacity building standpoint for these ongoing conversations. And we've had people who have come to the table who we never would have imagined going to them if we didn't have this opportunity of having an engagement with you all. So this has been tremendously valuable. This week we're going to, as always, talk about where we are in terms of update. We want to also really start focusing on those next steps. Last week, we spoke about the employment situation. And this week, we want to talk a little bit about health access and the support that's how we provide support to them. It's really important that people know this, because we are under very strict guidelines on things that we must do, and of course things that we cannot do or should not do. And we thought to just share this with everybody, because we're at that phase after they arrive and we've put them into housing. There are various steps that our new neighbors have to take to really integrate and be at home here in St. Louis. So we're going to talk a little bit about that. And we're going to talk about some of the support, the incredible support that keeps coming to this effort. And every week that we come up with a challenge, we see people thinking creatively and reaching out to us to find solutions. And we really appreciate that. And of course, we'll open up for any questions and answers. At this time, I'm going to turn it over to our Senior Vice President here at the International Institute, Blake Hamilton, who will give you the weekly update, and then he will turn that over to our other colleague who will talk about health access and support. Or maybe I think that will be done by Blake as well. Blake, please go ahead.
Doing it all today.
Yes.
Welcome again, everyone, to our weekly update. Just a brief update on our arrivals. We were set to have 36 arrivals today, though I can say that as of today, the weather does play a factor in this. We saw late last week, as the winter storm was hitting the Northeast, that flights got canceled coming off of the East Coast and in Virginia and Fort Dix in New Jersey. And so that disrupted some of our arrivals. Likewise, this storm that's moving through has the ability to impact arrival numbers, but at this point, we are still slated for 36 arrivals. We did have a case of 10 arrive earlier this week, and I believe we have cases of 8 and 9 arriving tomorrow. So we are working through this, the storm challenge, and we've had, in preparation of this, we've actually been working with our volunteers to help get food cards out into the hands of everybody ahead of our weekly delivery, as that's going to be impacted, of course, by the storm. So yesterday we had folks actually, volunteers and staff, distribute cards to people who are in the hotels and not yet having access to food stamps, so that those folks now have food and are ready to go. So we do have a housing update. We were able to move one case of 7 out into housing. This is a case that has been in the hotel for a couple of months now. So we're very, very pleased that we're able to move this case out. We also have another set of folks arriving, or pardon me, another case that will be moving into housing this week, but we had to postpone that because they were scheduled to actually go today. Roads are not really great for moving those large vans full of stuff around, but actually the house has been set up and the family will likely move into it on Friday. So getting those 2 cases of 7 out was a huge win for us. Getting these large cases is really our main goal in housing right now. And we're very optimistic that we actually have a clutch of housing that is able to support large cases that we've identified that will be moving cases into next week. And so it's 4 large cases of 8 and 9 that will be moving out and into instantly creating an Afghan neighborhood in a part of the northern part of our region. So we do have opportunities that are really getting coming to fore for us, that have really come from this group. And so I want to thank again everybody here for their help in getting us connected to housing and bulk housing as well. We have our staff members, but also community partners who are reaching out to landlords representing the agency and providing sort of an introduction before our staff take over and negotiate specifics of a deal. And likewise, if you have access to housing, whether it's 4 units to accommodate families of 8 or 9, or just one bedroom apartment, we want to hear about it. So I've included, again, contact information for Abdul and Galib here. And so I would encourage you to please reach out if you do have any leads on housing. We want to hear about it. And again, this area has, this meeting has proven very fruitful in terms of generating those opportunities. So I want to, again, put that out there. And likewise, we still have quite a few open positions on our website. We also have long-term volunteer opportunities that we need to have filled in order to maximize capacity. And one thing that I want to, that will tie into our conversation a little bit later today, but This group has also been really great at sharing our opportunities and linking to our jobs page. And so I want to ask you to continue to do that. We've seen great results. We've seen the numbers spike in terms of applications submitted and page views after these meetings. So please continue to share this within your networks, because we're seeing a great result. And we actually had 4 individuals just start the other day. And so every 2 weeks, we're seeing about 4 or 5 individuals starting work, and that's great. We still have about 25, I think, open positions on the site, with more to come. So please keep posting. The next point I want to mention here was an update around the Afghan Adjustment Act. This is an act that's making its way through Congress that is really pertinent to this conversation, as it directly impacts the ability of the Afghans that we're welcoming to stay in the United States. So as we've discussed here, Afghans are arriving on a new status that was created called Afghan parole. Parole, again, it has nothing to do with any sort of criminal history or the legal system. Really, it's an immigration category that was created for these cases that are in process to be adjudicated as special immigrant visa holders, but were evacuated prior to that status being confirmed. The Afghan Adjustment Act is a proposal in Congress that would allow Afghans to apply for permanent residency after 1 year of being paroled into the United States. So it relieves the immediate burden on that SIV process, because currently there's over 18,000 cases in the backlog pending adjudication, and there's not a real opportunity for all of the folks who have parole to have their cases adjudicated before that 2-year period expires. The other option for these folks is to go through the asylum process. And unfortunately, the asylum process is much worse off in terms of backlog. There's more than 1 million cases in the backlog for asylum. And what this act will do will prevent Afghans from being deported at the end of 2 years. They'll be able to live and work and continue to be present in the United States. And of course, there's tens of thousands of people, 70,000 at this point, that have been resettled that are in need of this sort of certainty. The existing immigration pathways that are there have such incredible backlogs and are very time consuming. But the other challenge here is kind of the cost, right? So if we had all of these Afghan parolees submit asylum claims, there's cost to that, and the estimated cost of having about 70,000 people submit these applications at a cost of $1,000 essentially per application. It's about $700 million that we're talking about in legal services that we needed to provide this. And of course, that's a very challenging sum of money to come up with for each and every individual that is being resettled at this point. And even if we were able to come up with that sum of money, the process is not aligned enough to be able to absolutely provide and provide an asylum decision in the time frame that is needed to prevent deportation. So I should say that the current affirmative asylum backlog is 600,000, and that is just a backlog that we don't expect to see being reduced anytime soon. So we are really hopeful that this is something that might be a cause that could be near and dear to the hearts of many on this. We'll have more information about engaging in advocacy around this, and we would love to get anybody connected who'd be willing to learn more and maybe promote this within their networks. So just a quick shout out and update regarding donations. We'll be talking a bit more about connections and community support at the end of the presentation today. But I did want to give a quick update that we will be hosting a distribution event for the donations that we've received to this point on February 19th. We'll be activating our volunteer networks through Christian Friends of New Americans, Welcome Neighbor, Oasis, House of Goods, and our own volunteers at the Institute to help get clients here to be able to collect goods from our gym. We're trying to make more room for the donations at our various warehouses, and making sure that families are actually getting everything that they need and then some. All right, we have an incredible amount of laundry detergent and hygiene supplies that we want to make sure we're getting out, in addition to larger items as well. And so we'll be coordinating for that event on the 19th. And if you're interested in getting connected for that event to help us organize ahead of that, or help on the day of, please do reach out, and Kelly and Carlos will be jumping on to talk a bit more a little later about getting connected for volunteer service. So with that, I will move on and beginning our conversation around health access and support.
Blake,
Yep.
Just quickly before you go on, I think there's a question from Elizabeth with reference to the Afghan Adjustment Act. And the question is there a consideration of adding other groups or people from other countries to the Afghan Adjustment Act?
Sorry, pardon me. That is not a consideration at this point. It's called the Afghan Adjustment Act, again, because of this this essentially stopgap immigration status that was provided. It is very much a short-term solution, and so this act is fully about ensuring a transition away from this temporary status into something a little bit more substantive, at least, if not long-term, something that actually has systems in place to support it. Right now, this temporary status with the clock that it's on and the number of people that are here under it is a real challenge. Now, as we talk about the backlog and 600,000 asylum seekers in the backlog, that it's separate, obviously a separate category from the folks that we're talking about here. But this, you hear calls for immigrant reform, and part of that is about addressing the backlogs across, frankly, all visa categories that needs to be addressed if we were to have a functioning system. And we're engaging in more advocacy around this, and so is a network of immigrant service providers, the Immigrant Service Providers Network, as well as the Missouri Immigrant Policy Coalition is engaging in advocacy around this. And I'd be happy to get anybody connected to the organizations that are with us taking up this charge.
Well, thank you, Blake. I think we can move on to the health access.
So my colleagues from our resettlement department and our social work department send their regrets about not being able to make this presentation. And in fact, we were hoping to have both present today, but instead you get me again. What I'll be covering here is really just the front end. So what we're talking about today is really the initial health services that are available to folks, and I'll be differentiating between what is available or required under our regular resettlement program for all refugees, and then how we've been extended some flexibilities under the Afghan program here. So as we've talked about in the past, initial health screening is a part of the regular resettlement process, whether somebody's arriving as a refugee or in the current Afghan parolee program. This is functionally a follow-up service to screenings that have occurred prior to arrival in St. Louis. For refugees arriving from overseas, there's a health screening that is a prerequisite for being approved for travel that must be passed, but it's really at that time that any health concerns are identified. Of course, nobody can be have any active communicable disease in order to be approved for travel. So even if it's something like latent TB, that needs to be addressed prior to travel, and it's something that will continue to be addressed post-travel. But those overseas health screenings and conversely with the Afghans, the health screenings that have taken place on military bases provide us with more information about how to serve cases, and especially identifying those with urgent medical needs that are arriving into the community. But regardless of whether or not somebody has an urgent medical need, we are having our initial health screening upon arrival. Now, for refugees, that initial health screening is required to happen within 30 days. Due to the pace of arrivals in the Afghan program, the federal government has provided us with flexibilities regarding Afghan access to initial health screening, and saying that that number should be closer to 90 days, or could be as many as 90 days. And we'll talk a bit more about kind of why that's the case, but functionally, there are challenges in terms of getting the number of folks that have been arriving at the pace that they've been arriving, access to these appointments, which are time consuming and done in partnership with a limited set of partners that have been approved to provide this service by refugee health coordinators at the state and federal levels. But essentially the pace of arrivals is something where that 30-day mark was not going to be realistic when it comes to Afghan resettlement. And so for the Afghan resettlement program, they provided the flexibility for us to be able to provide this service within 90 days. Now, there are still challenges in doing that, which we'll talk about in a little bit here. But right now, all of our health and screening, our initial health screenings for Afghans and refugees are happening in partnership with Affinia and the City Health Department. The City Health Department has a civil surgeon, which is part of the approval process for any of these health screenings. And Affinia has been wonderful at coordinating this with us. So we'll talk about how both have helped us expand capacity recently. These screenings are conducted for, as I said, a lot of communicable things, but as well as sort of identifying ongoing health challenges, including a TB screening, a lead screening, a screening for parasitic infection, and HIV as well. The initial health screening, or initial health services, I should say, not truly a part of the screening process, but another health service that was to be providing new arrivals is a primary care physician appointment. And for refugees, this is a required element, and the goal is to have that appointment scheduled and completed within 60 days of arrival. So with the volume of folks that are coming, we still have priorities for getting folks in. Of course, anybody with a documented medical case that we've received, the folks that have gone through medical screenings abroad who have been identified as having a health condition that requires immediate need, we are prioritizing for access to the initial health screening. Additionally, pregnant women, of course, are moved to the front of the line for accessing these services, and we have seen a lot of both of these cases. Quite a few women who actually became pregnant on the military base. There was, of course, rumors going around, as we understand it, that if you did get pregnant at the military base, that would somehow guarantee your status to stay in the United States. Of course, that is not accurate, but it does somewhat explain the inordinate number of pregnant women we've seen arriving. But this is one of those challenges that is complex in terms of very much trying to have sort of a culturally sensitive point of view around birth and around the process, and respecting people's birth plans and wishes, at the same time ensuring that they have access to all the proper care that's needed. And so for these complex cases, we engage a lot of our staff, frankly, not just our case specialists, but we've had our volunteer partners who are partnered with cases with pregnant women provide assistance in getting to medical appointments and caring even for the children post-birth. We're very thankful for the capacity of our partners help us build with their dedication. So this sort of string of health services and support are really aligned around that front end and ensuring that initially the screening is occurring and people are getting connected to care as soon as possible. And we've talked in the past about how St. Louis has something of a reputation for being able to serve these cases, medical cases, particularly well, which is why we've seen a disproportionate amount of medical cases relative to resettlements in other cities. None of that would be possible without the partnerships that we've created through community partners, some of whom are around this table, to get this work done. So again, a big thank you to all of you who support medical services for new arrivals. So some of the challenges at present in regarding the health screening, as I mentioned, the volume of folks that have arrived have really put us sort of behind the 8 ball, if you will, for getting these screenings done in a time-bound way. Now, even though we don't have a time restriction, or we've seen an extended time restriction in the Afghan case, we're still having trouble meeting that deadline. In January, we had 217 clients on the health screening list. These are not folks that arrived in January. These are folks that arrived going back to December November and December, where we had our large glut of arrivals. We have moved, again, as I said, medical cases, the pregnant women have had priority, but there's still folks that arrived a while ago who are still waiting to get those screening appointments. As I mentioned, Affinia and City Health have been wonderful about creating more flexibility, giving us more time and staff members to help process these health screenings. Recently, we've gotten an indication that City Health will be expanding their capacity again. That will help us serve an additional, or pardon me, up to 25 clients a week in our City Health screenings. That's great, but of course, in 4 weeks, we might only serve 100 of the 217 folks, again, that were on the list in January, not including folks that have arrived since then. So, this is, again, a part of the backlog that we want to identify. There are challenges in terms of further expanding capacity with the city and Affinia. They are stretched, of course, thin. We are in a pandemic, after all, that is really occupying a lot of their time and resources. So we're very thankful of their ability and dedication, willingness to work with us to expand options, have multiple days of health screening, and have more dedicated staff joining us for that. But one of the challenges is, of course, this recognition that any health provider who wants to help us build capacity must first really be approved by the state refugee health coordinator. So if you work with or are here on behalf of a health provider, are interested in learning more about getting connected to help with this process, I'd be happy to connect you to our state refugee health coordinator, who can tell you a bit more about what the process for getting a facility verified, or a group verified as one of these screening providers. Another challenge that has cropped up here is transportation for these health screenings. We're thankful again that Affinia and City Health have expanded capacity by providing more staff, but also having health screenings on more days. But what that means is that we must also coordinate transportation for folks to get to those various appointments. And so Affinia has been working with First Student Transportation to provide transportation assistance for clients going to their health screening appointments at that location. We are very, very much interested in getting additional capacity for transportation, and have been asking our volunteers and our community support groups to assist with transportation when these appointments are scheduled. Like everything pertaining to our programs, we're getting very little notice about those screening appointments getting scheduled, and so we're very thankful for the responsiveness of volunteers that have decided to assist with transportation, and their patients, as well. We have those appointments can be quite long, and so folks are providing transportation to and from. And we're very appreciative and very hopeful that the partnership with First Student will allow for more folks to have access to this very needed service. For the next time that we meet, we'll be talking a bit more about what happens after this. But I thought it was very important for everybody here to have an understanding of what are the requirements for these initial health screenings, what are the components of the health screening that are getting done, and how we're trying to manage this process, and what the expectation should be about when these occur. Of course, if you can provide a connection to help us solve any of these challenges, whether that's a health provider or even providing additional volunteer support or transportation, we would love to have a conversation around that. We are always looking for more partnerships that can help us get this done more effectively. One thing that we haven't really addressed here is sort of acute health needs. And something that we've been doing additionally, Affinia has been just a great partner all the way around for us. There was a case in one of our hotels that did identify as testing positive for COVID, and Affinia was able to work very, very quickly to help us have a testing clinic at that hotel. We're able to get everybody tested. So we're very thankful to the capacity that they've built for us. But there's a lot of acute health needs that are arising, and we'll talk a little bit more next time about how do we handle sort of these other needs outside of sort of this regularized health screening process, and what are sort of the ongoing supports for those with chronic conditions needing a continuum of care and support.
Thank you, Blake. There is a question from Marlene Schroeder with reference to, let me just read this out. If a new arrival settles in St. Louis County, can they transfer their medical records to St. Louis County Health Clinic after their initial screening?
Yeah, patients are eligible to provide that. I mean, that's something that they have to elect to do and initiate. That's not just something that's going to happen automatically. These are, after all, personal health records. So I know though that if they were initiating service then with the county health clinic, of course those records would be transferred as a part of that process, but not until they established care with the St. Louis County Health Clinic would that be automatic.
Thank you, Blake. And Paul did share in the chat here, Chelsea, who is the Missouri Refugee Health Coordinator, her contact email, just in case. So, since we're dealing with capacity issues here, it wouldn't hurt if we have a third organization that is supporting us in this effort. Any other questions for Blake? Without which I think we will turn this over to Kelly. I think Kelly and Carlos.
Good. Is it morning? I feel like it's morning, but it's afternoon. I'm Kelly, the Director of Community Engagement at the International Institute, and we are going to talk about opportunities for support. So I have the pleasure of managing right now our gym space and all the wonderful donations that have been coming in. The donations have not stopped. So we are so fortunate for the extreme generosity that we saw in August and September, but we are continuing to see generosity. So we are managing things coming in and out. And right now our current needs are new or gently used floor lamps and table lamps. Again, some of you have heard this before, but some of our apartments are the older apartments without ceiling lights. So those lamps are really essential for our new families. We did say new space heaters. Space heaters are something that we need more of, and we like them to be new because we don't want people giving us really old space heaters.
Hello.
That's my 5-year-old. Sorry for that. Okay, now he's going to be on screen with me. Twin and full blankets. Those are also really important items. Those items we need plenty of. Those we will need for the rest of the year, considering the amount of arrivals coming in. We try to give two, was it two, Blake? No, I can't remember how many blankets, but we try to give at least every bed one nice blanket. And when we say nice blanket, I mean the kind that we want to use today when it's cold outside and it's a nice comforter. So we have plenty of throws, plenty of TV watching.
Blankets, Kelly.
Sorry.
Every bed gets a minimum of 2 blankets.
Thank you. Thank you for confirming that. So 600 people, that means we needed 1,200 blankets. And then large serving platters, that one's sort of a specialty item. We've noticed when we've been opening the gym up to serve families, that's an item that we don't have a lot of. With the larger Afghan families, I believe it's okay to say that I think they're eating sort of more communally, and so they need larger platters to hold the rice and the goodness that they create. They don't need larger platters. They like larger platters. So those also can be gently used. And last but not least, our favorite thing to request for is grocery gift cards. We are just going through grocery gift cards like you wouldn't believe. So the people in the hotels have the chance to buy their own food with the cards. People who are still in homes that haven't been able to receive their benefits yet are going to grocery stores. So all the Chinooks are still really appreciated. Now, my favorite part of this call is the shout outs. We've been really busy. We had a coat distribution with the Christian Friends of New Americans. Thank you to them for helping us get the coats and shoes in the hands of people who need them. Welcome Neighbor, our wonderful partner as well, has been donating laptops. So we are, I believe it's near, is it near 80 laptops?
Yep.
Okay, that we're going to be putting in the hands of families. Food donations, these are really fun. Samim's Afghan Restaurant, Little Angels Foundations, House of Goods, and just today, Carlos and I made it happen, St. Gabriel Women at the Well. These are organizations that are providing meals, donated meals to hotels. So thank you to all of you for that. Yesterday, we had the pleasure of meeting Peggy from Temple Emmanuel, who raised $2,600 worth of Schnucks cards. Thank you to Temple Emmanuel. And last but not least, of course, we had yesterday the opportunity to welcome $300 of either, it was 150 in Visa cards and 150 in Schnucks cards donated by the, I'm sorry, I don't know how to pronounce this, Al-Mahdiya Muslim Community Center in North St. Louis. So no donation is too small. We appreciate all of our partners. We appreciate you. Thank you for being with us on these calls, and let's hope the sun comes out today so the snow will look prettier. I think that's all. Carlos is smiling, but Carlos can do the next slide.
Thanks, Kelly. And thanks, everyone. So yeah, just continually, we have a great opportunities for volunteers to support the work, great opportunities and great needs. So that can be found via our website. Just to emphasize that we do for all of our volunteers that they'll have to go through a background check for those that already haven't done so. It usually takes about 72 hours to process, and there is a $10 processing fee. But especially the volunteer needs that we have right now include what was mentioned earlier in terms of grocery shopping, transportation for arrivals, and medical transport, and a number of ad hoc needs. So all the support is greatly appreciated. Also, for those that want to engage more long-term in our community support program, please do reach out to our colleague Wafa there at the email, and we're also always gracious to accept donations directly in cash. We're going through a lot, as Kelly mentioned. We're going through about $6,000 a week in grocery gift cards alone. Most of those groceries are going to, or gift cards, we could use support for Schnucks because of accessibility to the hotels where our clients are staying, in addition to Aldi. And if you're looking to engage more, especially now during this kind of urgent call to action over the next month or so, please join our community coalition out of our command center. We're really looking to really scale up the support that we have here over the coming days and weeks to support these growing needs. And we have, we formalize our partnerships a little bit, and then we meet every Tuesday. So happy to connect on that. Feel free to reach out to us directly. Also, the contact information for our command center is listed there. It's great to reach us by the mobile phone number from the command center. So just want to say thanks again, and thanks to everyone for your support, and it's been amazing.
Thank you very much, Carlos and Kelly, for that update. At this point, are there any questions that we can address at this time?
All right, there's one in the chat that I wanted to reference. Marlene asked, she said, an immigration attorney told me that if parolees apply for permanent status before 1 year, they can stay in the country beyond 2 years while the case is processed. Is this different under AAA? That's not entirely accurate, right? So parolees cannot apply for permanent residency status, and that's the problem, right? So permanent parolees can only apply for asylum, or as for SIV at this point, right? So what the AAA Act would do would be to allow them to apply for permanent residency, which they're not able to directly at this point.
Thank you. Thank you, Blake. Yes, Elizabeth, please go ahead.
I had a question about what happens after February 15th. I mean, we've been hearing this number of roughly 950-ish, maybe 900 additional refugees coming into St. Louis. Is that still a number that we're working off of? Is the federal government so backlogged that they're not going to be able to bring that many in? Or
great question. Great question. So what they're telling us that they don't expect that the federal number will be hit. So the federal refugee cap for the year, which I believe is 62,500. They're not expecting to fully hit that this year, given the amount of time and energy that's been devoted to Afghan resettlement. So, we are still authorized, though we have not been told that we will get fewer at this point. They said it might be a challenge, but we still have those slots available for arrivals. So, we are still moving forward and preparing as if all of those arrivals will be coming. At this point, that number is now below 500, given or below 900, I should say, given some of the arrivals that we've had. But we do expect it, maybe if we don't hit that number exactly, we expect to get pretty close.
Yeah, thank you, Blake, for that response. Any other?
Marlene was trying to say something, but she was on mute earlier.
Marlene, please. Yeah.
I'm sorry. The attorney the emphasis, I think I used the wrong terminology. She had said for asylum that you needed to apply before 1 year, because then you could, even if the case took 3 years to settle, they could stay through that time. I mean, do you know if there's a difference between applying before 1 year and after 1 year?
No, we've not been given any indication that the timeline will change. What we have heard is that while in process, you could still be subject to deportation if the status is not conferred. There's been no guarantee that won't happen.
And this also opens up an opportunity, whilst with the advocacy conversation going on, and what this tells us in the context of this resettlement effort is that down the road, we're going to have to deal with a huge question of immigration cases, supporting these families to be able to go through these processes, which are always complex than they seem on the surface. But that's also something that we as an agency are thinking of building capacity. So when they start approaching that period, we are hoping to have capacity, and probably will also have to lean on the community for such support. But that's something that we would have to deal with.
And I want to mention that we do have an immigration working group that really kind of started here in our community meetings, that is meeting now once a month to look at regional capacity to support applications, not just for Afghans, but for everybody who needs them. And right now, as a region, we have extremely limited capacity to be able to handle the volume of need. And if in fact all the arrivals that we're seeing do need to go through the asylum application process, that really is just further, dumping more cases onto the plates of folks who are already overwhelmed with the number of cases that they're taking on. So we're talking about enlisting an army of pro bono attorneys who might be able to assist with some of the less complex cases, because certainly asylum is not without its complications, and it is a rather lengthy process that requires a lot of follow-up. But there are other cases where pro bono attorneys might be able to take those on to build capacity of service providers like MICA Project and Catholic Legal Aid Ministries and others who might be able to take on those more complex cases. As already mentioned, additionally, the Institute is hoping to build capacity, but overall as a region, this is a challenge that we need to address. So if you are interested in learning more about this immigrant coalition, immigration service coalition that's been brought together, I'd be happy to provide that to anybody. And again, if you feel that you might be able to lend some capacity to these efforts, please do reach out.
Well, thank you very much. And Jessica, I see that you mentioned something about the Afghan Chamber of Commerce, which was the announced at the press conference, where we're working to implement those programs. We've just interviewed and made an offer to somebody to be the program manager for all of those initiatives. I think that person was supposed to begin today. We're all snowed in, so onboarding can really take place. However, we are moving forward with that. We have already been in touch with Apple to furnish us with the 200 iPads that's in process. The order is on. And so we're also working to have an elaborate business plan that is going to define the housing initiative, how we're going to manage that, the Chamber of Commerce itself. I know that the soccer program for the kids is going to begin on February 12th. We'll have some announcement going out with reference to that, and coordinating with volunteers to try to get the kids out. And at 4 p.m. on February 12th, we'll share information about that. But good thing you highlighted that. So when we, in the context of the Chamber of Commerce, we're looking at really working with the Afghan community. I know that we have a meeting scheduled on February 10th with one group of because the Afghan community is very diverse. It's not just one specific group of people. So we're going to be having ongoing conversations with the community as we develop that idea. And obviously, Jessica, you're part of us. You'll be involved invariably one way or the other with this initiative. So we'll keep you updated. I think next week we'll have more updates, and we'll hopefully be able to introduce the program manager and her contact, and so we can all be in touch with her as we continue developing or implementing that program. Just to wrap up, Blake mentioned, and I don't know whether there's anybody from Affinia here, but really, we would really like to highlight our gratitude to Affinia. We're faced with a situation, and we reached out to Affinia, and they acted really swiftly, professionally to provide the testing that was needed for us to be able to assess the impact of the spread. And so we're really, really, really grateful for that partnership. And obviously, thanking every one of you that continues to contribute and support this effort as a community. We're really appreciative. With that, if there are no other questions, we would sign off here. Today is, the snow is out and maybe the kids love it. They're not in school, but it's just added a complication to this effort that we're all wearing smiles on our face, but it's really made it complicated for us. But we anticipated it and prepared for it, and it's all good. But I'll just say to everybody, stay safe and stay warm, and we will connect with you next week. Thank you very much.